Your client sustained a severe laceration to her left volar wrist as a result of domestic violence situation 6 weeks ago. Her median and ulnar nerves were repaired at the site of her injury, along with her FDS to her ring and small fingers. Her tendons have healed, but she has not regained any motor function yet. She is developing clawing in all of her fingers. Her surgeon is concerned that she may develop joint contractures and lose function in her hand, and has ordered an orthosis to improve her function and provide muscle balance to her hands. The anti-claw orthosis prevents the further development of joint contractures and provides muscle balance to the hand. This anti-claw orthosis holds the digits MCP joints in flexion, which blocks MCP hyperextension, as well as promotes IP extension of the digits. Since the client has not yet regained any motor function, specifically lumbrical function, they cannot position their hand in the preferred position, which is the intrinsic plus position. This orthosis provides the support needed for the correct positioning of the hand. The thumb is included in this orthosis since the damage was to both the median and ulnar nerve, and many of the thenar muscles have lost innervation as well.
The material we chose for this orthosis is Orthocast. Orthocast has a 2-inch width. It has minimum resistance to stretch and rigidity. It has high conformability and memory. It does not have coating and has a fast activation time. This material offers comfort for clients and is easy to work with.
This orthosis does not use a specific pattern, but rather a long strip of Orthocast material. Ideally, the piece you would use would be twice this width, so that after activating, you could fold it in half, seal it, and have a thicker piece that will add more stability to your orthosis. So, when fabricating the orthosis, we will start at the MCP of the 5th finger, bring the material around the dorsal aspect of the hand, and then around the palmar aspect of the hand, and pinch it where the material began. Continue over the dorsal aspect of the proximal phalanges and pinch on the radial aspect of the first digit. Route the material around the thenar musculature to include the thumb and pinch on the palmar surface to finish the orthosis. Leave the orthosis on for a few minutes to let it completely dry until you can take away the orthosis without it losing its shape.
Here are some fabrication tips for this orthosis. When molding, it may be a tight fit, so make sure to leave room so the client can take the orthosis on and off. Use the heat gun to secure all of the pinched areas, and trim away the excess material in the palm.
The client will wear this orthosis throughout the day, especially during functional activities that require the use of the hand. The client may take this orthosis off at night when sleeping, when bathing or washing their hands, as well as performing any therapeutic exercises. They will wear this orthosis for at least 6 to 8 weeks, or as we monitor the return of her motor function. Make sure that the client keeps this orthosis away from pets or animals, as they may chew or destroy it, and if it needs to be cleaned, antiseptic wipes will be sufficient. Always make sure that the client is aware of how to put on and off the orthosis, and that it fits and is comfortable. Always check with the client to be sure there aren't any pressure points or areas of discomfort while wearing.